Good night, everybody. I want to thank all of you to be here. For being here. My name is Dr. Jaime Mesa. Today we're going to talk about one of the subjects that I enjoy the most. You'll know now that it's diabetes. I want to thank Brightbot.com for sponsoring this webinar, and I hope you enjoy it and you ask very, very good questions, or questions that I love. Let me start. Let me remind you while I start that although this is some advice that I give, this does not replace medical consultation. So let's begin. As I already said, the subject today is diabetes, which is not a very not a sweet thing. How's affecting diabetes the Americans? Well, 1 out of 10 Americans has diabetes. It's already diagnosed, so 10% of Americans have it. 3 out of the 10 Americans is pre-diabetic, which is a lot. 1 out of those 4 out of those already diagnosed, out of those people who have or who are diabetic, 1 out of 4 does not know he has it, so it's undiagnosed, walking there without knowing he has a very serious condition. And 9 out of 10 pre-diabetics do not know they have it, so that's even worse. Most of them don't know it. And the important thing about those pre-diabetics is that one out of 3 of them will become diabetic in the next 5 years, and more than half in the next 10 years. So it is very important. And although I think numbers are not very important when talking to a patient, maybe for some of them that makes them realize how big of a problem it is. So I just wanted for you to know that this is a $245 billion a year problem. I mean, that's what it costs yearly to the United States. But what is diabetes? And I want you to know that I wrote the whole name for the condition, diabetes mellitus, for one reason, and is that there is another type of diabetes that I'm not going to be covering right now, and I'm going to talk about that later on the presentation. But just have that in mind, that we're going to be talking about diabetes mellitus, or DM, how we say it, both type 1 and type 2. What is diabetes? It's a condition in which the organism is unable to introduce the glucose, which is the sugar, properly into the cells. And that results in an abnormal quantity of glucose, sugar, that's free in the bloodstream. Because of course, all of us need to have sugar, and it travels free in the bloodstream. But we need to introduce that sugar into the cells so we can either store it for using that energy later, or simply to use it and obtain energy. But if it stays free, floating in the bloodstream, that creates a problem. So the diabetes is actually a condition in which the organism is unable to introduce that glucose properly. Why does this happen? Well, several things, but first we have to understand that glucose, sugar, requires insulin to enter the cell. Insulin is a protein that is fabricated, that it's made by the pancreas, which is an organ. The pancreas makes insulin, and that protein, let's say, that opens the door for sugar to enter the cells. Some people are not able to make insulin because the body attacks the cells of the pancreas that actually make the insulin. So that's an autoimmune condition. And some other individuals, they can produce insulin, but simply the cells start to resist the action of this protein. So in the first case, where you have an autoimmune disease, we call this diabetes type 1. Usually you are born with it. It's more common in young people and kids, although not exclusively. And and diabetes type 2, which is the diabetes that you develop over the years, probably after 40 or 50 years old, that you never had any troubles with sugar, and then suddenly you start developing. But I always like to show images because I think they're worth 1,000 words. So here it is. It's just a drawing, but maybe it can help you understand. In this case, those little hexagons, the blue hexagons, are sugar, glucose, and the key, it's the insulin. So remember, insulin opens the door so the sugar can go in. If there's no insulin, or suddenly the keyhole doesn't work as good, well, then sugar is going to be free on the bloodstream, and that's definitely no good. What happens then when we have free glucose in our bloodstream, or too much free sugar in our blood? Well, normal arteries need to be smooth. The inside of the arteries need to be soft, nothing covering, nothing like creating roughness. But with diabetes, of course, imagine like honey in a tube. It starts getting stuck everywhere and disrupting the normal flow of blood. So it helps blocking the arteries, and it also helps create a process which is called arteriosclerosis, which is the hardening and the hardening of the arteries. So it also helps create, if you if you were here in the past webinar, it helps develop high blood pressure also. But this is one of the things that could happen, and you can see there in the picture a normal artery versus a diabetic patient's artery. It also goes to your eyes, to the retina. The retina is the back part of your eye, where the actual nerve comes and where the image is created, let's say that. So the blood vessels start to get damaged in that part of the eye, so people start getting blind. That's why a lot of diabetics go blind. And also, it affects two things. One of them is the scarring process. People with a lot of sugar in their blood, they do not heal as fast as normal people. And second of all, it attacks, or it affects the feeling, the ability to feel. So people that normally you would feel something like you step on a nail, or on a I don't know, yeah, on a nail, you would feel that you have something on your feet. Diabetic people do not feel, so they have a lot of injuries on the feet, and since they don't heal as good as normal people, they'll develop ulcers on the feet. Why the feet, not the hands or the chest or the face or the knees? Well, it's simple. I mean, since the feeling, the ability to feel, is affected in the whole body. But of course, your hands, for example, you watch them every day. It's very easy to check on your hands because you use them all the time. But your feet, you wear shoes, you wear socks. So if you have an injury there, you might let a couple of days pass without noticing, especially if you don't feel anything. So that's why the feet are very important for diabetic people. And this is just an example of what happens to all of that sugar. But these are like main characteristics of diabetics, but there are more things that could happen. Who is at risk of developing diabetes? First of all, and this is very unfortunate, people who have a family history of diabetes. If your father was diabetic, if your mother was diabetic, if you have brothers or sisters, even grandparents, you have a higher risk of having diabetes, and you should start getting screened for diabetes as soon as possible. I think is the greatest risk right now. So we're trying to work on that, on genetic markers, so we can identify people who are gonna be diabetic since they are born. Now it is still not available, but probably in some years. Um, Hispanic Americans, Latin Americans, we have an increased risk of having diabetes. It's in our genes also. It's almost 4 times as white people, and also African Americans, or any black people of black race. They also shared certain genes with Latin Americans, or we shared certain genes with African Americans, and that gives us an increased risk for diabetes. And let's not forget that I already said before that also in African Americans, there's an increased risk of high blood pressure. So since they come together, in this case, that could actually be like recipe for disaster. So you should be careful with that. And of course, now, which is an epidemic, obesity, obese people have an increased risk of diabetes, also high blood pressure, but diabetes more than anything else. And this, which I don't want it to be misunderstood, but people that are using steroids. And when I say steroids, I not only mean like anabolic steroids, like the ones the people that weight lifts, that lift weight use, but also steroid creams for eczema. You use them too much, you might start developing insulin resistance, which is the first step to become diabetic. Also, people that like to receive steroids for certain joint pains, that's okay, but if you use them too much, it will increase your risk to develop diabetes. Of course, at first it will be reversible if you stop taking them, but in the long run, you might become diabetic. So be careful with that. How do I know I have diabetes? Well, this is the part that I'm going to explain about other types of diabetes a little bit, and this is just a fun fact, but I guess it's interesting. The word diabetes comes from Latin, and it means siphon. It was used to describe the number one symptom of diabetes, which is excessive production of urine. People that are urinating all the time, and try not to confuse this with like when you have a urinary tract infection that you want to go to the bathroom all the time and you just pee a little bit. No, in this case, it's the people who go to the bathroom like twice an hour, or maybe once every hour, and you pee a lot. That's why they call it a siphon, because they're always passing water and water and water. That's what diabetes means. And the thing with this is that before we had tests for diabetes, the only way that doctors had to diagnose it, and I know this will sound funny, but it's an important part of medicine and a fun fact to know, they used to taste the urine of patients. And they discovered that patients that had the same trouble, which was urinating a lot, some of them, their urine tasted sweet, like honey. In Spanish, we say honey, we say miel. So they call it diabetes mellitus, that comes from honey. And they discovered that some other patients, their urine didn't taste like anything. And they named that diabetes insipidus. Insipidus means tastes like nothing. So that's other type of diabetes. That's a fun story. I hope you liked it. But that's that doesn't have anything to do with blood sugar, so that's why I'm not going to talk about that. But I want you to remember that diabetes mellitus, number one symptom, urinating a lot. We call that in medicine polyuria. Second symptom that you might have, constant thirst. And of course, this come together. If you're urinating a lot, if you're going to pee constantly, then of course you're going to be thirsty all the time. So this is number two. We call that in medicine polydipsia. And the third one, it's being hungry all the time. We call that polyphagia. And this becomes the triad of diabetes: peeing a lot, having thirst all the time, and being hungry all the time. So if you have these symptoms, you better get checked. That doesn't mean you have it, but at least you should be checked for that. Of course, there are other symptoms which might be headaches, dizziness, vision troubles, many others, but they're not very specific to diabetes. And of course, similar to high blood pressure, the symptoms might remain very silent for a long period. So that's why now we check people even if they don't have any symptoms, because you might not feel anything, but that's damaging your body already. How do we diagnose our patients with diabetes? Of course, the first thing is that we have to suspect it if our patient has some of the symptoms or the triad that I mentioned. But we have basically blood work. Through blood work, that's how we do it. We can either do glucose levels in the serum, which is the blood. We can choose to do it either fasting or by something that we call oral tolerance test, which probably some of you know what it is. You go to the lab where your blood is going to be drawn. They take a first sample. They give you a little drink which contains 75 grams of glucose, sugar in water. You drink it, and then they take the sample 1 hour later to see how your body reacts to that load of sugar. Or we are using now something that is called the hemoglobin A1C, and that is the one I like the most. It's kind of new. At least we used to use it to monitor already diagnosed patients, but now it is approved to be used as a screening test. I'm going to explain a little bit fast what is hemoglobin A1C and why I like it so much. Hemoglobin is a protein that it's on the red blood cells. And if there is a lot of sugar in your blood, eventually it will stick to your cells, and specifically to this protein. So it will show in the past 3 months how much sugar has passed through your bloodstream. Why I like it so much, different from the other tests that I described. Because, for example, if you have a lot of sugar in your blood, but you made diet the past 3 days, the other tests will not show it. So you will appear normal even though you have diabetes. But hemoglobin A1C will still show like the history of the past 3 months. So this cannot, you cannot cheat with hemoglobin A1C. We say that children, drunk people, and hemoglobin A1C always tell the truth. So remember that in case you see it and you wonder why is the doctor requesting hemoglobin A1C. Well, that's the answer. People have certain questions, and I think there are certain doubts that they want to know the answer to, and I'm going to write like the most important. Can diabetes be cured? Not yet. Unfortunately, we are working on it, and we have great advances. As I was telling you, you can develop this diabetes either because the body destroys the pancreas or certain cells in the pancreas that create insulin, or simply the insulin stops working. So we are developing certain bacteria that can produce insulin, so they replace the pancreas. We are trying to create robotic pancreas, so they just put the insulin directly. They are still on trials with that, so now we do not have a definite cure. But if diagnosed early, it can be treated very effectively, and you can live a normal life with diabetes. Do all diabetics need insulin? I've discovered dealing with diabetics that they are very afraid of insulin. And I understand it's kind of scary having to give yourself shots of insulin. First, it's not as bad as you think. You get used to it. But I want you to know that no, not all diabetics need insulin. Actually, if diabetes is diagnosed early enough, some diabetics, most of them will not be able, will be able to live healthy lives without needing insulin. Actually, some of them with only diet will be able to control their diabetes. Some others will require oral medications, pills basically, and just one portion of people with either diagnosed later or with advanced or severe diabetes will need insulin. And a lot of people ask me this, and this is, I guess, a very important question. Does eating too much candy will make me diabetic? Because a lot of people say, oh, if you eat too much sweet, if you put too much sugar in your coffee, you will become diabetic. And the answer is yes and no. And I'm going to explain a little bit more about it. If you have a very healthy pancreas, it will it will not damage by itself. So you'll be able to eat as much candy as you want without actually developing diabetes. But you could, it might make you obese. And obesity, since of course your body grows and your cell multiply, now you need more sugar, more energy to give to those cells. So imbalance of those requirements of energy might make you insulin resistant. So yes, your pancreas is good, you produce enough insulin, but simply the cells do not react. They get used to having a lot of sugar, because since you're obese, you need to have a lot of sugar. So they get used to that, and then it's like it's not working. So yes and no. If you are healthy, if you're thin, or not thin, but in a good weight, and if you exercise, you might eat as much candy as you want, and you will not develop diabetes. How can we prevent it? Well, it's very easy. Although unfortunately, most people have diabetes because of a genetic problem, and there will not be a way to actually prevent it. Some other people, of course, they need to eat right, healthy, that's number one. Exercise, which is very common also, and get tested. There's no way to know unless you get tested. So if you feel you have symptoms or you have family history of diabetes, you should do it. This is very routine exams in your doctor, and they're also very cheap to do nowadays. So please do it. And remember that if you're one of those patients that enjoy steroids, try not to take them for a very long period, because you might develop diabetes. Thank you very much. I think diabetes is one of those subjects that it can be very, very, very long, and probably I'll be talking more about it in the future. That depends obviously on your questions, and I will give you now time to ask questions. So please go ahead.
Dr. Mesa, I heard you said that once you have diabetes, that's it. But you'll hear folks say that that they had diabetes and they're no longer diabetic. How can that be?
Well, if you ask me, I would say that's not true. I've discovered throughout my medical life that you hear all kinds of story. I am from Colombia, which is a country in South America, and I deal with patients that come from our culture. It's very rich in stories, and they trust in the old herbal medicine and natural medicine, and they claim, a lot of people say, oh, you know, doctor, I stopped taking the pills you gave me, and I was using this plant, this herb, this tea, and I feel great. And I do the tests on their blood, and they have sugar, their sugar is on the roof. So I really don't believe in that. I welcome everybody to try both. I mean, do not stop the traditional medicine. You can test something else, but believe me, I would be the first one to celebrate if one of my patients was cured of diabetes, but unfortunately, I've never seen it.
Okay. That would be wonderful, because I do contribute to DRI, which is Diabetes Research Institute. You know, I'm a big contributor to that.
Great. I mean, I think we're working hard on developing that. Part of it in our countries and Brazil and countries like that, we are working on medicine based on plants, because I mean, we do know it works, simply that it's not, at least it's not a cure right now. We're trying to develop it, but we have to be responsible with our patients and try to give them the best that we have. And right now, unfortunately, we do not have a definite cure. But yes, throughout research, we'll be there, I'm sure.
Okay.
Question.
Yes.
Okay, you said that the symptoms are urinating excessively, thirsty, and hungry, hunger. So
Correct.
all three, do they all go together, or is it just you have to have all three to have the signs? I mean, can you just have one and then maybe say maybe I might be a diabetic, or will you be able to figure it out by having all three?
Well, I mean, of course, we call it a triad because it usually presents the three of them together, but it depends on people. I mean, there are people who are very tolerant to hunger, for example. They can go an entire day without feeling hunger. So, of course, for that person, hungry will not be like a symptom they're going to complain about. So they will always say, you know what, doctor, I've been urinating a lot. I've been going to the bathroom every 30 minutes. And then when you ask them, have you been feeling more hungry than normal? They say, oh, you know what? Yeah, but I thought it was normal. So usually they do come in a triad, the three of them together, but usually one of them is more important to each patient, being urinating excessively, number one. That's I mean, every diabetic will tell you that when they're not treated, they will start urinating a lot.
Okay. I have one more question.
Please go ahead.
My doctor told me that my sugar was high and that I needed to exercise and change how I eat. I did that in September. I lost some weight and what have you, but I gained it back since then, and I go to the doctor in April. So if I was to lose the weight again and to exercise, would more than likely it would go down. My sugar level will probably go down. I'm asking that because you said that it can be cured, but if it's not hereditary, and they tell you that you have it, it'd be easier to get rid of it now, right?
Yes. As I was telling you, the second cause, the explanation why you have high blood sugar is because suddenly, even when you do produce insulin normally, simply the cells don't want to react to it. I mean, you have the key, but the door simply doesn't open. Why does it happen? Well, with people when you are overweight or obese, you have, I try to explain that you have a lot of cells now that need sugar. So of course, when you eat something, all that sugar is going to be free on your blood. If you lose weight, then the body will say, okay, I don't need this sugar anymore. I will get rid of it. So yes, if you lose weight, you will avoid developing insulin tolerance, which is the first step to diabetes. So yes, losing weight, it's a great way. If you don't have any genetic history of that or family history, losing weight is a great way to avoid developing diabetes.
Thank you.
You're welcome.
Dr. Jamie, along the line of that previous question, or those previous questions, I understand the cycle of urinating and being thirsty, and that's probably, I could say, understand it being a cycle. However, in general terms, what would make you be hungry all the time? I mean, in terms of what's the mechanism?
Well, you need basically body needs energy, and our body gets that energy from three main sources: sugar, proteins, and lipids, fat, let's say that. But we have to remember that for the body to use those three things to make energy, they have to be inside the cell of muscles, inside the liver, inside each cell that we need energy. In diabetics, that sugar, it's not inside the cells, so it's free in the bloodstream. So even when you do have a lot of sugar, the body is unable to use it. It's not able to use it for energy. So the body will think you need more sugar or more energy, and then it gives you the signal to be hungry and put it more. So it's actually like a circle in which you eat, but you're not able to use the energy, so you have to eat more.
Gotcha. Okay, thank you. I got one more question, sir.
Yes.
I think you had said that 1 of 3 pre-diabetics will develop diabetes in 5 years, and more than half will develop diabetes in 10 years. In your opinion, is that more a function of people not being able to change their lifestyles or get the proper medication, or is it just that in some cases it's just degenerative where you can't avoid that?
Well, that is one thing that I think is very unfortunate. Yes, there's a lot of those people who are not going to be able to avoid it, because as I was telling you, there's a very strong genetic factor here and in your family history. But we have to remember that being diagnosed early helps you treat it better and not having the complications. Because being diabetic and being well treated is like not being diabetic at all. So yes, unfortunately, the answer is that, and I do not like to say that a lot, because then people will say, if I'm gonna have it, then I'm gonna have it, and I'm not gonna do anything about it if I cannot avoid it. But I think what you should keep in mind and what you should remember is that you can avoid, and if you cannot, then at least you can be diagnosed early.
Thank you.
You're welcome.
Another question, Dr. Mesa.
Yes.
Folks talk about along the lines of taking the pill like a metformin or whatever, or glucophage. But I was told whereby that may be destructive to your kidneys. Some folks prefer to take the insulin shots rather than to take that pill. What is your opinion on that?
Well, I'm going to tell you my experience in that. As I was telling you, I worked before. I used to work with different population back in my country, and they have a lot of myths surrounding the treatments of insulin. And I started to find out that my patients were not using the insulin. And I talked to them and I said, hey, why aren't you using it? And they say, you know what, doctor? I don't want to use insulin because I don't want to be blind. And I asked them, where did you hear that? I mean, who told you insulin could make you blind? And they say, you know what? My neighbor is diabetic and she started using insulin and she is now blind. And and well, of course, you're not a doctor. That might seem like possible. Well, she was good before. Now she's taking insulin and she's blind. Well, you have to understand that diabetics will become blind if they're not treated. So what happens is that they start using insulin when the condition is so it's so advanced that the damage to the eye it's irreversible. But in my personal opinion, I try to use insulin as soon as I can with my patients because it's the best treatment. It's logical. If your body does not produce insulin, the treatment is insulin. It will not make you blind. It will not damage your kidneys. But if you do not treat diabetes correctly, diabetes will damage the blood vessels in your eyes and in your kidney. So it's the other way around. Diabetes causes damage to your eyes and your kidney. Insulin prevents it. I don't know if that answers your question.
Yeah, because that's why I said that folks prefer to take the insulin rather than the tablet because they are of the opinion that the insulin would work better for them than that pill.
And that is true. That is true. Definitely. The thing with that is that insulin can be dangerous because it's a hormone that basically makes all the sugar get inside the cells, and you have the risk of having the opposite, which is your very low blood sugar levels, hypoglycemia. So if you overdose on insulin, you might die. It's more dangerous to have low sugar than high. So we prefer to start on oral medications because we want to reduce the risk of our patients. But when it's unavoidable, we have to do it, and we try to teach our patients to use it in the proper way.
Oh, okay. All right. Thank you.
Okay.
Dr. Jamie, can diabetes cause you to have or to get glaucoma?
Well, I think there is a relation, not very strong relationship. Glaucoma is a condition in which basically the liquid that it's on the eye it's basically a ball, a balloon that is full with water, with a certain liquid, and that liquid changes all the time. I mean, you add more, the eye creates more of that liquid and then it's drained. So it's always in an equilibrium. Then by some reason, the siphon, the drainage, it gets clogged, and then there's too much of that liquid creating pressure on the eye, and that pressure damages the retina and you become blind. Some diabetic people, either because sugar clogs the drainage of that liquid, can develop glaucoma. But usually it's very associated with the use of steroids. So probably that might also be a relationship. You're using too much steroids and you develop both glaucoma and diabetes. That can happen also. Basically that's it. But the diabetics become blind, usually not because of glaucoma, but because of damage to the retina, the blood vessels there. So there's a relationship, but that's not the main cause of blindness with diabetes.
Okay, another question.
Yes.
If you don't eat a lot of sweets, but then all of a sudden you just have this urge to eat sweets just for one day, is that one of the symptoms?
Not really. That might be a symptom of hypoglycemia. So you might want to get checked for it, but not very typical. I mean, your body usually it's very wise. Let's say that. So if it's asking you for something, there's something not right. But of course, there are times in which your body just needs some extra energy and it will ask you to eat sweets. But that could be normal. I mean, I would get checked, but I wouldn't get too alarmed.
Okay.
So, is there any sort of physical activity that doctors kind of prefer to combat diabetes? Like, is there any specific activity that they're like, okay, we kind of prefer this for patients to do?
Well, diabetes is considered a cardiovascular disease. So cardiovascular exercise is the best. Cardio is the best you could do. Although in my opinion, I would say that not only exercising your heart, but also your every muscle in your body. So I would recommend like a total body workout. Why? Because yes, your blood vessels get damaged, and if you do cardio, it will improve that. But since I was telling you, sugar gets everywhere. Like imagine sugar entering every little place of your body. So if you work out those places, you will prevent the damage. So I would say like the more you exercise, the more parts of your body you do, the better it's gonna be. That's my opinion, but I would say cardio is the most important.
Yeah, I got a couple of questions actually. What is it called if there's too much blood in the sugar? If there's too much sugar in the blood, that's diabetes. But what happens if there's too much sugar entering into the cells themselves? What is that called?
Well, actually, I've never heard of it. I don't think it can happen like that. If there's what could happen, it's that there's a condition that we call hypoglycemia, but that's the wrong name actually, because hypoglycemia means too little sugar on your blood. But what actually happens is that people that are hypoglycemic, they have too much insulin. So that opens the door to the cells, and too much sugar enters the cell. So you might be referring to hypoglycemia. And that it's also a problem of the pancreas, like releasing too much insulin. And that can be actually the first step that is telling you that your pancreas is being attacked by your own body. So usually diabetics type 1 start developing hypoglycemia, and then they develop diabetes.
And how unreasonable is it for a skinny person to eat lots of sugar every day, lots of sweets, but this person stays skinny? Is it reasonable to conclude that this person, because he's skinny, will not get diabetes? Or would you say that even skinny people who indulge in sugar in that way might still get diabetes?
Well, definitely skinny people do develop diabetes. I mean, we associate it with being obese, but skinny people do develop diabetes. I wouldn't say it's very recommended to just start a diet based on sweets. That's something I don't think any doctor would recommend, no matter if you're skinny or not. I wouldn't say it's, I would say they have less possibility of developing, but they do have a possibility of actually developing insulin resistance, especially over the years. And just a little fact here that might not be related with your question, but I do want to tell you guys, is that when you have diabetes when it's not under control, one of the symptoms is losing weight. People would say that's not how they think it would work, but that's exactly how it is. We ask a diabetic, have you been losing weight? Yes, I lost 20 pounds over the past 3 months, or 30 pounds. Well, that's number one thing, that your diabetes is not controlled. Okay. Well, thank you everyone. I love your questions. I always do. See you, I guess, next Tuesday, that we're gonna have a new webinar. I would like to talk more about hypertension, high blood pressure. In some other webinars, I might be talking about Alzheimer's, which is something I really enjoy also. Please come by, visit us, and thanks again to brightbot.com for sponsoring our webinars. So have a great night.